Okay, so what I'm going to be demonstrating right now, I'm going to be demonstrating pretty much a typical adjustment. This young fellow here, he's been through many different chiropractors over the years. He's had traditional chiropractic care, and he's found his way towards me, and he's been doing this tonal technique, this light touch network spinal analysis with me. And so he likes the care, and he's been under care for quite a while. And since that he was already under care with another chiropractor, his nervous system was actually fairly well adapted and quite well developed. So when I started doing these adjustments, as you'll see, his body started to react quite quickly, and he developed these strategies that we're trying to develop in you when you come to get care. He developed them quite quickly because his nervous system was already a bit trained from other chiropractors. So this is pretty much like a typical visit that I would be doing. Okay, so here we have the person trying to dress comfortably, okay, in comfortable clothing. And usually what I'll do, I'll kind of analyze. This is of course after I've done the exam and everything else. And we usually examine some of the tension and the general pattern of the body. And I just check for just tension patterns that might be in the body. And there's a whole technique and a procedure of determining why and where I'm going to be doing what I'm doing. But this is kind of the idea. And I'll just have a general look at the spine. So I'm just checking just generally through his spine to see where he might have areas of what we would call subluxations. I'm just checking his general mobility as well. Okay, once again looking for areas where the spine is not moving properly, where there might be this area of subluxation or nerve damage or I'm analyzing his body at first. I'm going to ask him to turn his head to the right. Okay, so I've just kind of determined using some of my analysis here that I want to do an adjustment that is actually for the second vertebrae in his neck. Now, the adjustment I'm actually going to be doing, I'm actually going to be applying it here, in this area here. So you'll see that when we do this kind of care, there's a lot of stuff we do off the body before we actually go and touch the body. And it may seem like a lot of theatrics, but there's a reason that we do all this as far as the theory and the technique and the approach. But you'll notice that it's a very, very light approach. So what I'm going to be doing, I'm going to be applying a light adjustment here that's going to send a signal to his brain to start paying attention right there in his neck. So after I do that, we're going to try to move the camera up there and just take a look in this area to see what kind of reaction his body is doing. It's important to understand that when we do network care, I'm trying to develop two waves inside of your body. We're actually helping your body develop these, okay? It's like going to the gym or learning how to play the piano. You do it over and over again and your body will develop these strategies to self-heal the spine and the nervous system. So the first wave is what we call the respiratory wave, that when I do these adjustments, the person starts to actually breathe into the spine, because breathing into the spine will actually move the bones, release the tension, and that will help bring more proprioception or good movement signals to your brain. The other one is called a somatopsychic wave, where the tension patterns inside the body actually start to unwind themselves, and you might actually see the person on the table moving their shoulders, or moving their head to let go of the tension. Just do my first adjustment on him right now. And so we're going to want to look and pay attention right here, and just to see what kind of reaction his body might be doing in this area here. Okay, you may notice already that his body, they're starting to breathe a little heavier. More breath all the way through the spine. And we'll start to notice that he starts to concentrate a little bit more of his attention in this area here. Occasionally what we might actually notice is some of the muscles in the area will actually start moving, or they actually might start repositioning their head. Okay, so as he's going through this, his body's building up awareness of his spine and where the tension is. The breath is coming into the spine, it's bringing more good signals, good stimulation to the brain, and the brain is paying more attention to his body. And you can see that if you look in this area, some very subtle signals that his body's actually starting to pay attention there and starting to activate the muscles to kind of realign or to release tension in that area of his spine. Okay, now I'm going to go back down and just kind of analyze what his body did with that information. So I'm going to see if there's any decrease in the tension patterns that I might have noticed. Okay, so now I'm actually going to do adjustment that is for this area. If I just take a plastic spine here, if this is his spine here, in this area here, there's some pretty important ligaments, and I'm actually going to be doing an adjustment right in that area there where there's an important ligament that has a lot of what we call proprioceptors that kind of determine position and sense of your body and has a lot of neurological awareness. Just do a quick adjustment in that area here. And so I want to see a reaction of breathing in this area. And as you can see, there's a little bit more inflation of the area. It's actually starting to move and separate on its own. So his brain is actually becoming more aware of hypothetical tension patterns. And sometimes you might actually see in his body there's actual little contractions of muscles because the body's actually reorganizing the neurological and muscular system to heal the spine and the nervous system. Okay? And occasionally you might see in other places that his body's actually starting to release tension in different areas. Okay. So he's starting to develop a fairly good respiratory wave. It's a very relaxed kind of respiratory. Okay, as the body's basically going through to reorganize the tension because we're taking the insults that you've accumulated through your life, kind of like a spring, a loaded spring. Anytime some sort of trauma or damage has happened to your spine or a stress, sometimes it just gets coiled up in here and really compressed, and what we're doing is we're actually helping the body take that energy and use it to heal yourself. Okay, so once again, it's not me healing the person, I'm helping the body heal itself. We're developing strategies that you really haven't had before. You may have had it as an infant with their belly breathing. If you put a baby face down, they're breathing like this, and there's a lot of movement through the spine. Some of the other adjustments I might do, for example, in his case, most of the initial adjustments are actually done in this area here, indirectly to affect the spine. Somebody's further along in care, I might actually do adjustments further up in this area here, or right on the spine itself. So I'm just going to do one adjustment up here. Once again, this is still for this area here, and I want to see if his body starts to develop strategies to let that go, elongating the spine. Okay, this is more the somatopsychic kind of way that I'm talking about, where his body just knows it needs to do that. Okay, I don't need to tell it, and he doesn't need to know it. His body just innately knows what it needs to do to self-correct, what kind of movements it needs to do, what kind of muscles it needs to activate. And this is more the somatopsychic kind of wave that I was talking about prior. So this is a really good kind of correction. When I see the body, especially with children, I notice when I look at children, because I see a lot of children, and their care is more important than an adult. When we do these kind of adjustments, we see them starting to do what he's doing right here. We call this like a figure 8 kind of motion. When I see figure 8 kind of motions, I know that that's a really, really well defined and really healthy kind of movement for those vertebrae and for the nervous system in that area. It's a really excellent kind of thing that I'd like to see. And we see it very often with kids, very, very quickly. With adults, sometimes there's a lot of stuff we have to work through before they actually get to do that.